Hello and welcome to the June video. When you're watching this, we're going to be going through some interesting changes in our organization. I've said a few times that when we look at airplane flights, takeoffs and landings are the tricky parts. Cruising altitude's generally pretty smooth. Well, we're about halfway down the runway on our takeoff. We're going from the COVID era to a full-on back to normal, or whatever is the new normal. So I want to ask you a couple of favors. First, I want you to recognize that there's going to be some bumps in the road as we go through the next few weeks. Getting the organization back up to full speed is not going to be smooth and easy. There's a lot of complexity. And this month, I want to take the opportunity to have a few people talk to you about the specifics of us getting back to normal. I also want to ask you to be extremely patient with our patients. Like us, they are going through some turmoils too, trying to figure out if it's safe to come back and get care that maybe they feel they need. They're probably a little concerned about their own well-being on many fronts. And they're certainly concerned about the impacts that they have on their families, just like many of us are. So let's take a few seconds and hear from some other people in the organization about our resumption back to normal.
Thank you for joining me today. I want to talk a little bit about the hospital status update as we continue our journey towards recovery. Before I do that, I wanted to tell you thank you and show you some appreciation for all that you've done to care for our patients in the community during this pandemic. It's been an unprecedented time for Guthrie, for the community, certainly in my career, as it relates to COVID-19. And this organization has pulled together, collaborated, and has invoked our Guthrie values of patient-centeredness, teamwork, and excellence in order to care for the communities that we serve. We see our recovery efforts continuing forward. Our volumes in the hospitals are starting to go up. We see visits in the emergency room at 76% of pre-COVID levels. We see our admissions throughout the system for our hospitals at 85% of pre-COVID levels. And more excitingly, even with the restrictions in New York, we see our surgical platform growing to 92% of pre-COVID levels. And that is something for us all to celebrate. We could not do that without being a team and working together. We continue to navigate the regulatory environment of both states as the governors lift the executive orders. We continue to have to test, especially in New York, our pre-surgical patients and make sure that we have enough supplies to be able to take care of them. Our PPE supplies are something that we all have to work towards making sure we manage collectively, and we know that that's going to be a challenge going forward. We're cautiously optimistic as it relates to the future months and recovery, but we don't know what COVID-19 will bring us in the fall and certainly in the winter. Thank you very much, and be safe.
I want to give a big shout out to all of our GMG providers and staff. Through these past few difficult months, you have all been right here taking care of our patients. We have never closed our doors. And even when patients could not come to us, our providers found a way to see our patients through the use of telemedicine and even making house calls when needed. As summer approaches, our offices are open, all of our clinicians are working, and all of our services are available. And our staff have ensured that we have adopted the strongest safety standards, including appropriate social distancing, required masking of all patients and staff, temperature and symptom screening, minimizing the use of waiting rooms for patient visits, and increased cleaning and sanitizing all contact areas through the day. Through the hard work and dedication of all of our Guthrie staff, we have rescheduled literally over 10,000 office visits and over 2,000 surgeries, and our office volumes are returning to normal. We are doing what we do best, taking care of patients and taking care of each other. And I couldn't be more proud of this organization.
I'm very excited to begin a conversation today with you related to our remote workforce and what our next steps are related to our remote workforce. And I know that's very top of mind for many of you, but I first want to pause and say thank you. Thank you for all that you have done over the last several months to ensure that the well-being of our organization, our patients, and our staff have continued. The commitment by the Guthrie family has been felt and has been very impactful in providing that commitment to our patient care. When we began our COVID preparation, I think it's important to kind of really understand some of the work that happened that really drove the remote workforce work environment. As part of that infection control and making sure that we're keeping our employees safe, we decided to actually move over 700 of our employees off-site to a remote workforce. As the environment has continued to change and evolve, our approach in terms of how work gets done will continue to change and evolve, and we know many of you are eager to return to the work site. To do that, we want to make sure that our commitment to keeping our employees safe is the same. It has not lessened. It is still top of mind. And so we have a process that we have gone through and will continue to go through to ensure we do just that. We also have realized that some of the transitions to the remote workforce has worked tremendously well, and we're going to continue to evaluate some of those populations for continued work, either in a hybrid model where they work a portion of their time on site or off, or perhaps transition to a more permanent telecommuting opportunity. But those opportunities are continuing to be evaluated by our senior executive team. And again, with what is top of mind is making sure that we're delivering on our patient promise and ensuring too that we're most productive and effective in the deliver of the work that we're entrusted to. So I'm excited to welcome you all back when the timing is appropriate. But I'm also very excited in terms of the commitment and the processes and the protocols that we've put in place to when we do that, it is in fact the most appropriate and in the most safe manner.
I'd like to thank a few people. I'd like to thank everyone that was involved in each entity's Emergency Operations Center and the Infection Control team. These people worked very hard trying to maintain safety in our facilities and prepare us so that we were ready for any number of patients that may come to our facilities. Their hard work and dedication is greatly appreciated. I'd specifically like to thank Sue Hohenhaus. Sue is the Vice President of Patient Safety, and she was our System Incident Commander. Sue's knowledge, her experience, and her leadership were instrumental in preparing us for this pandemic, and we thank her. We are now in a new phase. This phase is marked by a reopening and a lifting of restrictions by the states that surround us. In Pennsylvania, these states are colored, they're yellow or green, and in New York State, they're usually numbered 1, 2, 3, 4. But the main point is that the restrictions are being lifted for our patients and for our community. This new phase brings new questions. It reminds us that we need to remain vigilant for what may happen in the future. Many people ask, as there are restrictions that are lifted from each state, will there be a higher incidence of infection? And the truth is we simply don't know. We don't know what will happen as people mingle more and they modify their behavior. The other question that often comes up is, will we see a surge in the fall? What we do know is that in the fall, we always see more patients in the hospital and in our offices with respiratory illness. Pneumonia, the flu, these things always increase. So we will be busier in the winter, and we really don't know what it means to have COVID on top of that, but we will be prepared for it. This gives us a new challenge. It's really two systems of care. We need to take care of our patients that have COVID-19 and require that type of care. But we've now resumed all the usual care for patients that need urgent or elective care. Balancing these two systems is the new challenge that we face. Our community is counting on us to be ready, available, and be here to take care of all of their needs. So I thank you for your support, and I thank you for your dedication to our patients.
So as we welcome people back to our campuses and various facilities, I want us to remember that the needs of our patients have changed. They're now focused on safety, and they're going to be concerned that their experiences with us not only are timely and convenient, but are also safe. So take an extra moment, make sure that we convey that message to our patients, and make sure that our environment is in fact as safe as it possibly can be. We really appreciate all of your help and cooperation in this time. Thank you very much.